Okay, so I'll just do just a brief, quick introduction. So you guys are probably tired of hearing my voice and seeing my ugly mug, but we're just so excited that you all are here and being a part of this. We've got Professor Taylor here, and you've probably seen some of the correspondence and marketing about this, but he's really here, and he's an amazing history. So I really want you all to take copious notes and listen to really his wisdom and what he has to say about um, what's gone into his career getting into healthcare, what he's done afterwards, um, his expertise even in strategy and relationship building and just some things that really he has such a wealth of knowledge for. So we've titled this, the federal healthcare or government, looking at kind of from a government standpoint as well. But I think we couldn't really put into words exactly what it would be. And so I think that, as much as we can engage with Professor Taylor, please ask questions. We've got some that were submitted last week via social media and a couple of other ways that we gathered those. So we'll try to interject those here and there. But please feel free to either, show your camera, unmute yourself, raise up a hand is probably the easiest way for us to see that you have something to ask, or just utilize the chat as well. So I'll just Professor Taylor, I'll probably just interrupt here and there, just if there's a question that maybe pertains to what you've got on the screen. But otherwise, what we've started off a lot of these sessions with is asking, our resident expert, where did you go to school? What got you into healthcare? What were your degrees? And then, it's always fun to know, what was your first job out of college? So we'll start with that. Thank you.
Okay, well, thank you. And thank you all for being here today. And I really appreciate people turning on cameras. It helps to connect because I like to see you make a face or grimace a little bit when I see something a little wonky. It's just important to connect. And in this day and age, I don't want us to become too comfortable disconnecting. And so, because today what I'm going to talk about is the federal health care. And I'm going to talk a little bit about not only how did I arrive in it, but how it sort of developed and created me and my own mindset and my point of view, and how that overlaps with healthcare as a sense of service. So you're going to hear a little bit different story than you've heard from some others. So first, me, I'm going to give you a little background, but I'm going to give you another story in pictures. I I have an undergraduate degree in architecture. I got my undergraduate degree at University of Texas, Arlington. I'm a local kid, grew up in Louisville. And I will tell you, the only reason I went there is because the Air Force offered me a scholarship in an engineering degree. I was straight out of high school. I was managing a Kentucky Fried Chicken my senior year of high school, which, by the way, was great experience for future parts of my life. Here I was an 18-year-old kid and I was manager of my own store. And I was hiring and supervising my high school buddies. But I learned a lot from that. And frankly, from my dad, who taught me, my gosh, I was mowing lawns at 12 and he was making me pay Social Security. So I learned early on what responsibility was about and obligations. I also worked my way through college after this. I was a janitor and I waited tables. That became important in life about no job beneath you, about a sense of service, what it means to be proud of what you do, no matter what you do, at any point in this opportunity. So I started my first assignment, literally graduated. I went to TCU and UT Arlington, TCU for a lot of my Air Force stuff. 10 days after graduation, I reported on active duty in Dayton, Ohio, as an architect to a medical research lab. I had no clue what I was doing, what I was entering, but I arrived as this brand new 22-year-old kid, second lieutenant, and I was responsible for 22 of the most sophisticated medical research facilities in the world. I was responsible for their buildings, for their infrastructure, for operations, and for design and development of future ones. Unbelievable at 22 years old, and a vivarium of 22,000 animals. It was unbelievable where I had to deal with not only the health and well-being of the research animals, but also the media who was criticizing us outside the gates for researching on animals. I mean, I learned a lot about things as a young guy, but that really introduced me to the world of healthcare. And I went, oh my gosh, this is different. Here I am, an architect, and my buddies are all docs. My buddies are all these biomedical research guys. They were who I hung out with. I was reassigned at the end of that tour to an engineering site where I was asked to design roads and to do some other infrastructure design. And I got to tell you, I immediately realized my future is not in designing buildings. My future, I care about healthcare. As I say, it found me. I immediately began to petition to leave because I heard there was an opportunity in the Air Force Surgeon General's office for 12 architects to design hospitals and clinics for them worldwide. It worked. I moved over. My first job was downtown San Francisco, where I was responsible to work overseas. So from that, this is just a little bit, this is a real quick picture of my history. Here I was, this young kid in that research lab in the upper left, and I actually was a test subject. I was sent to USC to become an expert in human studies, in life, in safety oversight of human use in medical research. I went, oh my gosh, how better to do that than become a subject myself? So I rode the centrifuge there as a human subject testing ejection seats for fighter pilots. I did that for 3 years because they paid me $100 a month to do it. I mean, it was really cool. And it was exciting. I got a flight suit and I got to act like a fighter pilot. It was pretty cool. But then I got opportunity in the rest of my career to travel. You can see me there in a Ryokan in North Japan when I was over designing a hospital. I went to Egypt and advised the Egyptian Surgeon General and the government on building a trauma center when I was a young architect there as well. Then I went into administration and management. That was part of my transformation. So I was there in South Carolina as the hospital administrator waving. Then I started moving into more levels of responsibility, where I was chief of policy for the Air Force. I developed all of their benefit structure and all. Then I became, you can see me there in my formal dress. Then I became a commander, CEO of a hospital in Arizona. I was the first non-physician to ever command the hospital at our only F-16 fighter training base. Well, that opened up an interesting door because my boss, who was a fighter pilot, said, hey, Don, you want to fly in the back seat of these fighters every week? And guess what? I ended up flying every Friday afternoon in the back seat of an F-16. Just having fun, learning about what they do. That was really an interesting opportunity, all available only because of the federal health system. Now, partway through that journey, I was going to leave. After I had had my tour in San Francisco, I was about ready to move on. And they offered to pay for my graduate degree if I would stay an additional 4 years. So I went to Penn State. I was getting an MS in health planning. And by the way, they changed the degree to an MHA while I was there. So I also took, I took all of my other electives and I took additional courses because they were essentially free. So I ended up getting an MS and also in information systems, particularly decision analysis and simulation and modeling before there was really PCs. This was back on mainframes. But I had this great opportunity. So here's one data point. And I know one of the questions is, when should you take your master's degree? When should you go about take a master's? I had been in healthcare operations for about 7 years before I went to grad school. But during that period of time, I designed hospitals and clinics, interviewing physicians, executives, nurses, technicians, enlisted, housekeeping, logistics. I had interviewed all of them to create what I called the optimal design. Through that, I learned a lot about healthcare operations. So when I went to grad school, oh my gosh, it was simple. Number one, they were paying me for all my degree and they paid me a full salary. I had all kinds of time. I structured my time there as I did at work. I arrived every day at 7 a.m. I worked all day, 5 days a week till 5. I kept very copious organized notes. And I ended up with both in all of my academics there 4.0. And by the way, I never really had to study on weekends. It was just this discipline of work introduced into the graduate program. I was also one of the top 5 students in Pennsylvania in graduate school because of my contributions. And I was also the student appointee for faculty, represent the students in student government with the faculty at Penn State as well. So therefore, I tell you, that experience is really important because I would end up in class debating the faculty at times about reality versus academics. They loved it. The faculty loved me. I co-authored 3 articles on emergency room utilization and public health while I was there. So it was really a lot of fun. But I learned I needed to do more than design buildings from that time at Penn State. So I went back and became chief of planning. From there, I went on to do planning for all facilities, which required epidemiology and studies and benefit structure. Then I became an expert in the benefit care, our health plan, administrator for a hospital, business operations guy at an academic medical center, worked for the chief doc, overseeing all the physician business activities, where I got to sit on the what I call the executive committee, the medical staff, and help co-chair that. So I learned healthcare from a physician's perspective in my early days. That was really meaningful later on in my career. Then from there, I ended up working in Washington, overseeing all TRICARE for the Air Force, and policy and oversight of the administration of records and our informatics, as well as designed a supplement to Medicare and helped work that through the Hill with Medicare and the Ways and Means Committee and the House and Senate Appropriations Committees. It was interesting to learn how all of that works. And sometimes I looked in the mirror and I go, I'm just this stupid little architect. How did this happen? But my point is the federal sector opens opportunity up for you. And that's unique, I think. At least I felt it was unique because it offered a little bit more than I did before. Toward the end of my career, they were having trouble with our largest medical center, which had about $1.2 billion budget and had about 8,000 staff with volunteers in San Antonio, Texas. The number 2 person there, the commander was a 2-star general. They wanted me to be his vice, and again, first ever non-physician to ever do that because they had some business problems. So I changed their entire governance structure. But I could only do that because I had built a history of credibility with a lot of people. So I had a legacy of people who knew me. That is another benefit of the federal structure. This morning, Tim talked about it being a closed world. Well, in the military or in the federal system, it's a very closed world. Everybody knows everybody's business. And they already know about you before you ever arrive at your next job. So I found that to be interesting. But from there, I really had an opportunity for the pinnacle job in my career, which was to command a trauma hospital in Balad, Iraq. I broke a little glass again because I was the only non-physician to ever command there. And I happened to be there during a very turbulent time when Bob Woodruff was hurt. I was commander for his care. And I dealt with a lot of media during that period of time. I dealt with 60 Minutes. I dealt with ABC, NBC, CNN, National Public Radio. And I learned a lot about media intervention during that time as kind of a representative or a spokesperson for our mission. But you got to meet guys like Lee Greenwood and Brooks and Dunn and some other cool people during my time. But it was the most challenging leadership job I ever had in my life. And everything I had done up to that point culminated in me being able to do this in a selfless, very serving point of view. And I, sometimes even, and then you can see in the upper right, that mural, as an architect, you kind of do a little sketching sometimes. Well, I hadn't painted murals in years. And so while there, at my last month there, I took an hour every afternoon and I painted that. And that was my legacy to the follow-on assignments. They would walk by that to go to the hospital to work every day. And it just was me kind of expressing my thanks to the team for doing that. And those are the barrier walls that protected us from rockets and mortars because we were getting rocketed about 3 times a day. And those would protect us from those coming in and detonate out before getting to us. Yes, and I had to hide 3 times in bunkers while I was painting that when the alarms would go off. But my point is, it offered this great opportunity for me to serve. My greatest, though, was both my daughters served. And I've got to share this because it becomes sort of a legacy in our own family. My daughters were both fueled by this sense of service that I grew into over my time. I grew out of selfish needs into a selfless sense of leadership. And that's what is, I will attribute that to the federal system and to the military. Because Balad taught me what caring in healthcare is about. And I speak about that in other venues about how I learned to care in the ugliest place in the world. So my daughters both served, and they both still serve today, not in the military. My youngest daughter at the upper right just finished her bachelor's in healthcare management, and she's in the VA in San Antonio. My oldest daughter went on to grad school at Georgetown and is now a senior analyst in the State Department. and travels all over the world working with them. Uh, good, good girls, good kids, but their foundation was in federal service. And it was meaningful to me because I was able to give both of them the oath of office in different venues. Okay, so sorry to digress a little, but my path was a little unique. And it didn't stop as I finished there, because I ran a private company for 5 years, an engineering company. I grew them, tripled their size in 3 years. I also served in the VA for 2 years. I've done independent consulting. I've done coaching. I worked at UT Southwestern as a project manager. And now I'm in this kind of new phase of my life where I'm finding I love to teach and I love to speak, because all of these lessons over my, yes, and I will say almost 40 years in healthcare, have collected experiences that are relevant still today to the challenges. But let me tell you, what is really powerful in the federal system is a sense of service and a sense of purpose. So that's the part that differentiated it for me. Healthcare is meaningful regardless of where you serve. It's not like making Chevy trucks, guys. I'm sorry, I couldn't do it. The engineering company, I couldn't get excited about that because it lacked that higher level of purpose for me. I love to be able to help people grow and affect lives. That's my reward, is seeing these aha moments, or this gratefulness of doing something really significant for them. The federal system allows you to develop purpose and a sense of service and align toward your very core being. It allows you to do that in various venues. So, whoops, a little slides off there, but let's start with the Veterans Health Administration. I worked for 2 years in the VA. When they got in trouble, here I am doing consulting. The VA gets in trouble. It's all over the news. Guess what I do? I start dropping applications. Put me in, boss. Put me in. Take me in. Put me in the game, coach. I'm ready. I'm ready. Here to help. I'm here to help. And sure enough, they hire me and send me to North Chicago, which is the only joint federal facility with the VA and the DoD and the military health system. So I'm the number 2 guy there, the associate director. I joined, had a great time there. They immediately, after 1 year, asked me to go to where all the problems started in Phoenix. So I went to Phoenix and worked a year as well. Very challenging, all leadership challenges, but I went there to help. It was all about a sense of service. The VA is huge. It is the largest integrated health system in the nation. They have 1,255 facilities, about 300,000 employees, and they're everywhere in the nation and international as well. Massive opportunities for them. And I will tell you firsthand, they have some challenges on the horizon. I had a Zoom call with the undersecretary of the entire VHA about 4 weeks ago. He and I had a Zoom call talking about the next level of strategy for the veterans healthcare and how it needs to move as the private sector is aligning with various changes. Pretty significant. The military healthcare system. This is the one I served in as well, but I served 27 years here. And this is really unique in that you serve all the people in the military today that are serving today. You serve their families while they're on active duty, and you serve retirees in that system are all available and have access to the military healthcare system. If you didn't retire, your care is available in the VA, in the veteran system. That's where it gets a little different. And it is a completely different system. Very few people understand they're entirely different secretarial departments. They're entirely different budgets. They're entirely different health plans. They're entirely different access and structure. But the patients are the same, just at different moments in their lives. Very awkward and very frustrating to a veteran as you're trying to move through this system. Because one day you're in the active duty military, you and your family are covered. You leave or separate. You go to the VA, your family has no benefits the next day. None. It is really a difficult system. And that's the very thing that I've been talking about with some of the senior leaders about. The military health system is combined of the Army healthcare system, the Navy healthcare system, which oversees Marines, and then the Air Force healthcare system, which I served in, that's now creating a Space Force health system as well. And the new Surgeon General of the Space Force is a young man I mentored who called me the day after he was selected, thanking me for making a difference in his life when he was a brand new lieutenant. And he said, just want you to know I'm thinking about you today. And he's going to be a trailblazer, but that's a significant system. They care for at home families, the active duty military, as I said, under a structured benefit, very similar to private sector healthcare. The quality of care is the same, if not better. The access is very much the same. The struggles are the same. The costs are the same. Policies and oversight are exactly the same, all accredited by the Joint Commission, all accredited by AAAHC, all the other things we have to do, military healthcare system does as well. However, in the event of war, you're asked to go and serve. And you're asked to go to a combat zone and provide trauma care and sometimes primary care in a combat zone, which I did for 6 months. That was our normal rotation. And in doing that, yeah, okay, it's a little bit of risk, but it's also incredibly rewarding because it's what you really prepare for your whole career. And at that moment you go, wow, I know how to do this. I know how to do it. And it's special when you can do something really good. Like I couldn't do surgery, but I had some of the best surgeons in the world working with me, and I made sure they could do their job. That was my leadership role there. So when we were in a mass casualty event, I was the guy getting them Gatorade and mopping the blood off the floors. That was my job. I was a follower in that role. But on a daily basis, I was their boss. And they just knew that I was there to protect them from noise, from uncertainty. That's only found in a structure like the military health system, where you have a chance to contribute in that way. Yeah, we did some great things. I created a primary care home model in Arizona that was nationally renowned. It changed everything. I briefed, I spoke at MGMA conferences, I spoke to the VA, and we were a nationally recognized model of primary care home, of medical homes and its structure. We were just 10 years too early. It didn't resonate in the private sector because we were ahead of the game. I had population health structures that were working and effective. We were just ahead of the model. And that seems to always be, is I usually be, oh yeah, that's great, you're just a little early. Which is a little frustrating because we had the opportunity inside the military health system to do those things. Indian Health Service, another massive opportunity, which is embedded inside HHS as a structure in Health and Human Services. Again, federal service. As in the VA, you were hired under a GS grade scale, and you were hired through the way that they hire in their various grades. In the military, you come in through a commission in ranks, and your pay scales according to that. The GS is very similar, except in the ranks line up with the GS scale. But it's a very rigid hierarchy of grades and escalation. Indian Health Service is struggling. They're really struggling, particularly during the pandemic. The tribal nations, even on the coronavirus tracking sheet with Johns Hopkins right now, they are tracking the Indian health reservations now by COVID outbreaks uniquely separate than states, because they just don't have enough healthcare capacity to respond to the demand and need. And they have a lot of just inherent health issues, preventive health issues over time. A very rewarding opportunity. The Public Health Service also provides a lot of things. You've seen them very actively today, working with the Surgeon General of the United States. You see him in the white uniform, sometimes on stage. Well, he oversees this. They're responsible for a lot of oversight in the nation, and they also have a structure of hierarchy very similar to the military structure. These are the agencies under public health within HHS. All of these are federal agencies, some that are related to healthcare specifically, all in varying degrees of public health and public health need, or they have public health or they have healthcare jobs within them. So you can see massive opportunities in the federal government to do this. But I got to tell you that, I found that healthcare was really less of a job and more of a calling. And that came about over my time. it became such a passion to me that, by the way, I can't switch off. I became, I served on the National Board of the Air Force Association and built their nonprofit, their Wounded Airman program, to care for kids who couldn't care for themselves. I have since done lectures about this. I'm the chairperson right now of the Air Force's Healthcare Administrators Association, and I do that. I can't stop caring about this, and it's just something I do. And it's, as I said, it wasn't my job. It's who you are. And this became kind of a calling for me. And I discovered it in those early days as I moved from my architecture background. So you would ask the question. Now I'll get into just a couple of mechanics, details. Then I want to get to your questions real quick. If you want to find a job in the federal government, this is the only website to do it. It's called USA Jobs. You go in and this is the intro screen. This is exactly what it looks like. At the top, I'm going to give you a few keywords to search on, but a few codes to search on. But through that, you'll find all the jobs available in the federal system that covers public health, it covers IHS, it covers the VA, and it covers the military, all within a certain niche of your qualifications. I highly recommend you go into this, you play with it, look around, and then when you're ready, you create a profile. And that profile is your resume. It's a little bit of background and supporting documents. Once you have your profile built, it's pretty easy to apply. You just click a job, apply, and it uploads all of your documents. You go through a unique survey to that job, and you're in. But you got to be careful on some things when you see the job posted. I'll show you here. This is what they'll look like. These are two that's popped up on my chart right now. One of them is when the job closes. Here's the executive director right now. This is the senior CEO of VA health facilities. There's three of them with. This closes tonight at midnight, Eastern time, by the way. Midnight Eastern time. So you go, okay, I popped it up there as a saved job because there happens to be one of those in Hampton, Virginia, that's next door to a friend of mine who oversees a DoD facility within 2 miles of that. And I'm going, oh, that's kind of cute. I don't want to move. So that's a challenge. I don't want to relocate. But you can see the jobs pop up and you click those once you know where they are. And you see, and it fits in your profile. These are the series you'll look for. Healthcare Administration is 0670. You'll put that code in the search bar. It'll bring up all of those available jobs across all those particular government entities or federal industries. Health System Specialist. This is where most people enter the federal space, is in the 0671. This is where healthcare project management is. This is where program analysts start. This is usually where people who don't have what I call the advanced degree start with a bachelor's degree and enter into the space. I had no idea there was a 673 with housekeeping management. Had no idea that was there, but it's there. It was listed today. Then there's a public health side you can look for at the 1725 code as well. I recommend typing in public health to see that. This is what will show up in the public health side of things. You'll see a list of jobs. You want to click open to public because some of these are internal to the federal government themselves and locked out. So you want a job that's open to everyone. This is same with some of the 0670. This is healthcare administration and some of the jobs. And then you'll look at the specialist. This is the one with the 0671 with health system specialist. And you can see there's 58 of those jobs posted right now. Pretty cool to see that. And it's a very well organized site and easy to use once you play with it. I will tell you, when you do open a job, read the job requirements in detail. I have been disqualified once a number of years back because they wanted my previous salary history on every job title on my resume. I didn't do it and they disqualified me. So pay attention to the requirements and the way they ask and the questions and the qualifications. There's full spectrum opportunities in the federal government, just like any other healthcare system. Same accreditation, same oversight, same budgetary issues. It's just we don't work for a profit. We have to close out with zero money lost and zero money earned at the midnight on the end of our fiscal year. So you don't earn profits. You're not measured by that. Pay scale, generally you start at about 50,000, give or take, in the early entry jobs. But I will tell you, the federal pay scale is nothing like the private sector. you will max out probably at 170 to 190,000 a year, even as a very high senior executive. I can tell you right now, the very highest people in the VA in Washington, D.C. right now only make about 190 to 200. That is way less than the private sector. But that's okay. I wasn't working for pay. Your retirement plans are quite robust, and you get opportunity to travel and do some really great things. Also, get prepared to move. You're going to move if you're going to stay in the system. In the military, you moved every 4 years. If you were a commander, you get more senior, you moved every 2. And those are okay. You just get used to that. But it's easier than moving in the private side because everything's sort of set up in your next job. In the VA, you move as you get higher in seniority as well. But just remember, you don't have to move, or you can move. That's the other beauty, is you can move without loss of seniority. Your pay grade sustained, and you can move to promotion. That's what my daughter's going to do in San Antonio. She's hanging in till she can move to Colorado Springs and get a promotion out of it. That's what she wants to do. So there's plenty of what I call entry jobs, project support, analyst, entry administration, all the functional areas. This is against logistics and finance and facilities and infrastructure, administration, clinical support, clinical practice management, clinic management, laboratory, ancillary. You can do whatever. All of those have requirements for administration support. And they're great jobs. Then you get higher levels of responsibility as you move up the chain. You get to learn. They train you. Big investment in education and training. As I talked about, they covered my grad degree in the military side. Learning digital thinking and IT, it's across the board. Those are all really good, and you get chances to do all of that. And they encourage development. Even if you want to get advanced degrees on your own, they pay for part of that. You become a mid to senior level on the functional, and then you can get into executive leadership. After that, you move to the senior policy, which was one of the questions here. You really have to have some time to be credible, to develop senior policy. That's the kind of stuff I like to advise on now. I've been around the block enough, have a little private sector. Now they're interested in listening to me again. Kind of interesting. And then after you finish that cycle, you're kind of where I am, consulting, speaking, and teaching. And I love that because now I finally have something to say. There's growth in federal healthcare. Trust me, there will continue to be growth in that system. It is growing, more investment in it. I'm going to just cover these. I'm just going to share these with you and point out a couple of things as I wrap up so I can get to questions. It's no different in the federal system than anywhere else. You got to know the industry. You got to think digital. Yes, project management is a great entree key into the jobs. It differentiates. The first thing I told my daughter, who's in the State Department, get your PMP certification. And she did, and it opened doors for her immediately, just because she had the PMP certification on her resume. Ethics is a massive issue. One of the questions here was, how do you deal in the federal sector with all the pressures of lobbying? Well, I will tell you, in the federal sector, ethical behavior and integrity is very black and white. You're taught that from day one. Your leadership skills are developed from the very first day. It is very clear to you what's right and wrong, and you know what not to do. I loved that about the federal sector because we did not discuss politics, we didn't discuss religion, and we didn't discuss sexual orientation. Sorry, I'm being very clear. I loved working in an environment where I didn't have to deal with any of that because, it's so prevalent in so many things and caused so much divisiveness. We didn't deal with that. We just didn't deal with it, and it wasn't part of what we could do. But we never, ever really allowed ethics to enter because we just knew what was right and wrong. Your colleagues, you got to stay with your network. This group here is great. I can continue that. Your first network starts with your school friends. Stay in touch with them, the faculty. Your network should never, ever drop off. Always, always, always nurture and invest in your network. It's real important. Those relationships, you have to invest in them before you ever need them. Don't assume your friends are going to be there if they haven't heard from you in a long time. You've got to invest in them. And by the way, you have to give them some things they need. You have to help them when they're challenged as well. These are just tips. I'm going to leave this with a slide deck, so I'll send this to Quincy so she can make it available to everyone. There are things you play, and healthcare is not different in the federal sector. You still have some things to deal with. but by and large, they expect you to function as you do in other systems and in other healthcare systems. Always, always be a learner. I highlighted that. Your education never stops. I never stopped learning. I'm still learning. I just finished a certification in coaching with a national company, and we're now moving in to try to coach executive nursing, who's dealing with some major issues right now in PTSD and pandemic response. So we're hoping to coach them to help them grow and help them cope with an uncertainty in their workspace. All of these things, so we're always learning, always learning. I'm just telling you, be present, please. Just be present. Put down the phone. And when someone's talking to you, pay attention. There's no such thing as multitasking. Just, it doesn't exist. Don't be distracted. Be present for someone. It's the greatest gift you can give them. Yes, there's a lot of change right now, but be change excited. This is a real moment in history to adapt and to do things. You have permission to respond to something, to be vulnerable and respond. If this is the time to pivot or change the way you look at life, change it. You got an excuse? Everybody's coping with this. I'm reflecting myself. My gosh, I need to get out of this a little bit better than I arrived. But we learned from that. The pace of change will never be as slow as it is today, guys. I'm telling you, it's only going to ramp up, especially as we emerge from this. These are all the links to all of those entities I talked about. This will be in the slide deck that I share with you. Okay, I'm done. Questions about stuff? Let's open it up. I really want to chat with folks.
One question I had earlier this week was, what are the opportunities for students to explore in this DFW area?
In the federal sector, it's somewhat limited. The VA here, Steve Holt is the director of the Dallas VA. He's a friend of mine I worked with in Chicago. They just opened a new hospital they purchased in Garland. So they have some opportunities in the Dallas. When you go to that site on USA Jobs, just put in Dallas, and you'll see all the federal options and opportunities that are open here. There's also massive need right now for public health support. And that's at the federal sector, by the way, because each of these counties have affiliated public health advisors that are funded by the federal government. And there's unique COVID jobs right now that are funded as well.
Anybody feel free, I've got questions here, but feel free to unmute yourself or stick a question here in the chat box too.
Hi.
Hello, who do we have?
Hey, this is Paula James. Thanks for speaking, Colonel Taylor. I actually served in the Marine Corps for 4 years before I went to college at UT Austin. So thanks for
your service. You don't look like a Marine.
Well, so I live in Colorado now, and I work for UC Health doing health IT. But I've been wanting to move over into the federal side of the picture just to have a more structured, I guess, employment system. My husband does work for the federal government too, which I am really appreciative because they do have the best benefit system ever as far as health insurance and whatnot. But I wanted to ask you, like, what kind of advice did you have for your daughters for selecting the kinds of jobs that they're going to apply to in the federal government, and then also like deciding how your skills were going to transfer into the specific positions that they're applying to?
Okay, first you have to, the first thing, thank you for your service, by the way. I really mean that. You picked up some pretty important skills during your time in the Marine Corps. I know you did. You'll also have, because of your prior service, you have preference in some of the hiring of jobs. Do you have healthcare experience beyond recently? Did you do healthcare in the Marine Corps?
No, so I was an admin of the, personal admin cleric in the Marines. But I've worked for UT Southwestern for about 2 years. And then I've been with the University of Colorado Healthcare System doing health IT for the last 3.5. So about 5.5 years. I'm doing the master's in IT management through UTD now.
Oh,
so I don't know, like, if I can use the ongoing master's as something to leverage a position that I'm applying to, or if it's only based on previous experience.
Previous experience will mean a lot in the federal sector. It'll also open a few doors. you obviously have an undergraduate completed already, and so that's going to get you some open doors. Now, are you in the Springs area, Denver?
I'm in Denver.
You're in Denver itself. Yeah, Denver has, there's federal opportunity there, of course. There's the VA system, new facility. And then there's a little bit of healthcare with the military side out in Aurora at Buckley. And then, of course, if you're south, the Springs has huge amounts of military healthcare opportunity as well. There's also some public health needs inside the Denver space as well. If you move outside of DoD and move into the public health side, there's plenty. I would just begin to look at the site. You're going to be eligible for jobs rather quickly. You'll also get preferential selection because of your veteran status.
Mm-hmm.
Now,
I had an interview with the VHA actually, but if it was for a GS-13 position.
Yeah,
so
that's going to be
I
hard.
thought, so I thought they probably thought they needed more experience from the feedback I got. Yeah. But like, what GS scale should I be applying to with, an ongoing master's, 4 years of military experience, an undergrad in biology, and then 5 years of health IT?
I'd be looking for somewhere between, you may enter as a 9, go to an 11, but you probably need to be looking at 9, 11. And then once you get to an 11, then you're going to get into the 13 pretty easily. Once you complete the master's for certain. The other part of this is for your eligibility, and I'm just going to make a statement here. I'm not going to ask for an answer on this. Is your VA disability rating is an important differentiator in application. Make sure that's complete and that's current.
Okay. Thank you so much.
I would just leave you with that.
Okay, I appreciate that.
Hey, thank you.
Thank you.
And if you have questions, you can reach out to me through UT Dallas anytime.
Thank you so much.
Thank you. You're on mute, Quincy.
Thank you.
No
so
problem.
Another question that has come up just from a few students is, okay, are there extracurricular activities that they could be considering now while they're either in undergraduate or graduate programs? Do you know of internships, or are there job shadowing opportunities, or something that they can implement now to start gathering some experience while they're in college?
Well, let me first say, yes, all of those are relevant, and yes, they're important on your resume. Make sure you highlight those on your resume journey. The other part is within the USA job site, there is a section for new graduates, and they open it up and they have federal internships available there. So they'll tell you where and how they're offered. So just go to the new graduates section and just play around with that and look for it. I can tell you what's important is that the federal system isn't as rigid in your experience as maybe the private sector is. I have found the private sector is looking for an exact perfect fit for anything they need. They're not as open to interpretation. The federal sector is, okay, we just want to hire willingness. We don't have to have you know it already. We're going to develop you into something we need. We just need to have the capability and that you have some basic interest and knowledge. Because the federal sector always intends to grow you into something else. Its intent is to invest in you throughout the remainder of your career, because a lot of people stay once they're in. And they do that through development. That is the military system. I know it's done in the military. I've been mentoring, and I still mentor and coach people in the military side. But I had a mentor when I was a second lieutenant. I mean, just my first day, you have somebody you go to that's a safe place to ask questions. So there's this constant investment in your growth and development that I love and I kind of miss. I didn't, not to criticize, but I didn't really have that in the private sector. I really didn't have someone I could openly just say, hey, I'm struggling with this, or what do you think? I just didn't have it. People were just kind of busy. And I think the intent is that's why waste the time. You'll be gone anyway, one way or another. You'll move on, you'll get promoted or something. In the military system, you stay connected. You may get reassigned. My closest friend in the Air Force was a pediatrician doc that I worked with 35 years ago. And we just became buddies because we were kind of hanging out in the same places. He was interviewed last week to be the next Surgeon General of the Air Force, 3-star. And I'm his safe place. When he needs to just be, a knucklehead, he calls me. We'll do a virtual online discussion, and he can talk about anything with me. That is unique, and I consider that very rich and a great value from a kind of a life of service. And I will say I miss it, guys. I miss it. If that doesn't show, it should have.
That's great. Well, so another question sort of related here is, what are some recommendations from you to advance your career, or I would even interject that to say to start your career in public policy related to healthcare?
You could either, if you really want to start with public policy and you want to really be underappreciated or overappreciated, work for a congressman or work for a senator. And make sure that whoever you choose to work for is aligned with your own political views. That's real important, because you're going to be asked to focus on things you have to care about. But you'll get a great start into development of policy. That's a really good way to start. But you'll be on the political chain in the federal side. They don't get paid well. Trust me, they don't get paid well. But it is a start. And I have friends that have moved on and it becomes significant. Matter of fact, I knew a nurse who did that with Senator Cornyn, and she's now a senior executive in McKinsey Consulting. So there's ways to do that once you get into the policy chain. The other one is to serve a career. Once you serve a career, then you know how it operates. Then you can become an advisor on the policy side of how it's done, either through consultancy or through a senior position inside that government entity, or even on the Hill. I know guys that like me that retired that become senior advisors to senators and congressmen in health policy.
Thank you. Well, and so then I guess something that pops in my mind, sort of aligned to these questions too, is, okay, on the contrary of what you just said, let's say you're working for somebody within the federal healthcare space that you don't align with politically, but it is your job. I would ask you, how do you balance that, or what are coping mechanisms, or do you have advice if that ends up happening?
Well, you get to the point is, first of all, you have a mission to do, and we're very mission focused. You just do your mission, you do your job. I really don't care about anybody's politics. I really don't know, don't care. It's all about the patient. I only cared about serving those that we served and the folks who chose to serve them. My job was to work for the people that I was responsible for, and I worked for them. I didn't get caught up with my boss. I didn't get caught up with what they thought. I just did not. That became too frustrating for me, and I couldn't second guess them. And so my point is, I trusted them. That's the way we work. And then I created a relationship, but I never got caught up in what I call those thin things. And those are just distractors. Because if you really are in healthcare for the right reason, it's all about serving patients and taking care of those who are on the front line serving them. That's what it's always about. And I like to now, when I teach, and even in my classes at UT Dallas, I mean, I teach the business side of this. Yes, I do, and the history of the U.S. system, but I blend caring into it, because that's important that we rediscover the caring element of our health system, not healthcare system, of our health system.
That's good perspective. I think we have listening ears on the call. That's good.
That's my view.
So we have someone who maybe wants to ask a question here. Jim Ramsey.
Hey, Don.
Hey, James.
How are you?
I
just graduated from with a master's program in healthcare in Dallas. Don't really have any prior healthcare experience. I have in other industries, and just moved from Dallas to Washington, D.C. Any suggestions or tips on how to start in terms of getting into the healthcare industry here in Washington, D.C., whether at a policy level or at an operational level? And how would I go in as at this point?
Good question.
Well, you would first, if you want to work in this, the only way to get into the jobs is through the USA Jobs portal.
Yep.
And I got to tell you, you just almost have to completely populate that with your applications.
Mm-hmm.
You're gonna see a lot of them in Washington. It may not be on the right side of town because you have to commute. Commutes in DC, by the way, differentiate where you work.
Well, fortunately, I'm right in the middle of DC, so I'm actually in DC itself.
Then you're perfect. And I'd start looking at headquarters VA is where I'd look. The DHA is on the left side, is out toward Leesburg on the west side of town, but I would look for headquarter VA. They're going to have on-trade jobs in there right now. And you are going to have to accept the fact it will be an on-trade job.
Mm-hmm.
Be the beginning. You have education, you have career experience that you can modify to meet those application criteria that you'll see in the job, because they really look for experience, not just healthcare, experience.
Mm-hmm.
And private sector experience is valued. Leadership is valued. So just sculpt your resume so that it allows you to look versatile, energetic, impassioned. That's what they like as well. And that you are adaptable. You're here at this next cycle of service.
Okay.
And by the way, yeah, write a great cover letter too. You want to have a great cover letter that's not extensive, but it's from the heart.
Mm-hmm.
And if you're in the VA, you got to talk about serving veterans. I'm sorry, but that's what they do. And
sure.
if you don't have a soft spot for the veterans, you probably don't fit in the VA. And you may subset that into a niche, like Paula mentioned earlier, her interest in the federal side. Well,
mm-hmm.
If she has an interest in women veterans, there's a massive opportunity to grow the women veteran space right now, because they have no idea how to start women's health in the VA. Because remember, already perceives that it's kind of a World War II veteran place to go for hospital care. Well, they're struggling. They're struggling with emerging with women. They're struggling with women and unique needs that women veterans have. They're struggling with younger men and women who have experiences from this current war that most healthcare systems don't deal with, particularly PTSD, some unique mental health challenges, dependencies, injuries, physical injuries that are tough, brain injury, orthotics, missing limbs. I mean, there's all kinds of burn injuries. There's all kinds of things that's unique to that population. The VA is very good at, but they struggle with doing things they haven't done in the past,
mm-hmm.
like senior care. They don't do senior care well, and I'm telling you, they need to get out of that business, because it's almost like they apologetically do it, but they need to get out of the senior care business. They don't do that well. They don't do primary care as well as they probably could. There's a lot of potential there. But I think you could write a nice little resume and have a cover letter and apply for the right job. Don't over apply, because you're just going to get kicked out early.
Yeah. Okay. Very good.
And populate it. Before I got my job in Chicago, I mean, you heard my background. I'm qualified.
Yep.
It took 40 applications for me to get the interview.
Wow.
Just to tell you.
Persistence.
You got it. You got to just keep doing it.
All right. Very good. Thank you.
Thank you. Quincy, I can't hear you.
Second time in a row here. So thank you. Anybody else have a question? We've got right around 5 minutes or so left of our time here in this session. Yes, we have another one in the chat. Either feel free to post it or just unmute yourself or show your video would be great.
Hi, Professor Taylor. I'm Madison. I'm a junior undergrad in healthcare management, and I wanted to know, out of all the experiences you have in leadership and in jobs, which was the toughest one you had to go through, and what did it teach you in the healthcare system?
Oh,
good question.
Oh my gosh. Could we all stay on another hour? Thank you for that question. It's almost like I wrote it for you. I will have to say my time in Balad was the toughest, for reasons different than you may think. Yeah, it's tough to be in a combat zone. It's tough because you're going, oh my gosh, I got to do healthcare. I've got to do this. I put pressure on myself because I wasn't the physician. All the previous commanders had been trauma surgeons. And I was afraid of being responsible for the busiest trauma center in the war at the time, being a non-physician and having it fail. It would have been catastrophic for me to not succeed there. So I did a few things that were different for my rotation because medics are experiencing, and if you don't know, medics experience PTSD as well. It's happening in COVID with some of the frontline workers, particularly out of New York City, as they become the bedside attendants for those passing. That happens in the combat zone as well. And I knew that because I just put myself in their place, and it's kind of seeing things through their eyes. And I said, how can I make life safer for them? How can I make them return? So I challenged them. Before I left, I had 450 people working for me there. And I said, we're going to return from this opportunity healthier than we left. So I'm challenging all of you to either become physically stronger, spiritually stronger, emotionally stronger, or financially stronger. I'm going to ask you all to pick. And every day, when you and I talk, I'm going to ask you which ones you selected and how are you doing on your journey. You wouldn't believe the response to that I got. People lost weight, they buffed up. I mean, I was doing spin classes for an hour and a half on Sunday afternoons to earn a scoop of Haagen-Dazs ice cream. I mean, it was, I said spiritually for me, I attended church more on the chaplain. A little strange to stand there with a 9mm strapped to my side singing hymns. But you know what? I learned something about me during that time. My entire team connected with themselves. They had a bond that was unbelievable. I spoke to that at a couple of mental health conferences nationally about that approach to a traumatic environment. It worked. That and the leadership was hugely responsible, but after a while, I just became myself, and I learned I was there to serve them. Once you put in your mind, you're not the boss. You're there, you're responsible for them, and you're there to work for them. Once you get that in your mind, it becomes much easier. All the decisions become very easy. You arrive and you're proud of the moment. And some people, got a little slippery slope there. I had some ethical challenges. I'll give you one story I had with a surgeon who wanted to stop us seeing non-US patients for brain injuries. And he called me at 2 a.m. to tell me he was going to stop it. I drove in, I got dressed, drove in, said, why are we doing that? He goes, we're out of blood. Each one of these cases was 100 units of blood to do a surgery for a brain injury. We were doing 3 a day. He goes, I got to save our blood for US forces. I said, okay. So I slid him a piece of paper. I said, write your name down. I want it very clear and legible. He goes, why? And I said, when the Washington Post covers that we have triaged patients based on nationality, I want to make sure they get your name right for making that decision. He goes, you can't do that. And I said, I absolutely will, because that's what you've done. He goes, well, what do we do? And I said, let me do my job. He goes, what's that? I'll get you blood. 3 hours, I had him all the blood he needed. Called in some favors with the Navy and bypassed the Army. So it worked. But my point is, I learned so many rich experiences from that time, and I still apply them today. We're all just wanting to make a difference in the world. That's why I stay in healthcare. That's why I hope you all are getting into healthcare.
Thank you.
Thank you.
Thank you.
One question that we've asked the previous faculty and professors as well is something along the lines of, what's one thing you wish you knew then that you know now? And framing that as a form of advice to the students who are on the call.
I wished I had known then to fill in, here. So this is gonna sound a little weird. You want to be relevant your entire time, but just being present and working hard every day in your current job doesn't maximize your relevance. You also have to be credible in another space. Like, I wished I had gotten my ACHE certification earlier. I'm qualified to be a fellow. I just haven't taken the exam. I need to do that. I was certified in another organization. That would have opened more doors for me. It would have made me more relevant in a larger space. Associations are important. My network, I wished I had known to develop my network both internal to the federal into the private sector earlier. I have lots of friends, but I needed to have an effective network that I could depend on and count on that was growing with me and knew about me over my history. It wasn't enough just to do my job great. I needed to do my job responsibly. And that would have been me investing a little more in myself and investing a little bit more in my network and my relationships. And my last one is, don't forget your family. That's for another discussion sometime, but there's some hard lessons there too.
Type in this as you're speaking. If I miss anything, anyone feel free to add. It's kind of nice to have these chats are accessible, so it's nice if we can go back and kind of get some nuggets of wisdom, so that's great. Thank you very much. Anybody else have a final question for Professor Taylor? Well, as he suggested, please, know that you can reach out to him. I think that there can be some individual, follow-up, or if you are, if you on the call are truly interested in pursuing that. So, what I know Professor Taylor, he is accessible and always willing to answer questions. So please reach out to him. There are a few other things going on this week, so we hope you're taking advantage. We just thank you so much, Professor Taylor, for your time and sharing your wisdom. And we hope you all take care and have a great day.
Thank you all.